All right, let's get into our next discussion now. Malaria is preventable, treatable and curable, yet it remains a major public health concern in Nigeria and Africa.
Yes, indeed. Now, the National Malaria Eradication Program, NMEP, recently revealed that Nigeria loses an estimated 300 billion naira annually to treatment and prevention, including loss of man-hours annually to malaria. It says malaria is also responsible for 11% of maternal deaths and 30% of child deaths every year.
Now, former Nigerian President Olusegun Obasanjo has also joined his voice to revelations on the heavy cost Nigeria bears on malaria and other endemic diseases. Now, he says the country's poor financing of the health sector is responsible for the present challenges it is facing in combating diseases. For him, it is even more worrisome that many Nigerians die from diseases that could be prevented. Yes. All right, we have joining us Tui Mebawundu, a medical doctor, joining us in the house right now. Good morning.
Mike, good morning.
Good
nice to see you.
Nice to see you.
Yeah.
Right.
Okay, malaria is one of the commonest diseases amongst Africans, as the case may be. Everyone knows about malaria, knows what causes malaria, knows how the beginning and the end of how it all starts and ends. But over the years, no matter how government has come up with financing, come up with strategies, come up with other kind of templates to eradicate malaria, it still doesn't go away.
Yeah, again, it's like you rightly said in the preview. How can a disease that is preventable, treatable, and curable be causing as much as 300,000 deaths in Nigeria, afflicting more than 2 million people, leading to 11% of maternal death, 30% of childhood death, and even 15% of low birth weight? How can malaria that is curable, preventable, and treatable be causing such a humongous amount of financial loss to the country, and we're not having a way to deal with it? And we've seen that even some countries have moved beyond control of malaria to elimination of malaria. Countries have moved, even countries that are even less endowed than Nigeria, they've moved to that level. So what is happening?
That's a
question. Like you rightly said, we are not even devoting the attention it requires to actually control or even eradicate malaria. If you look at a typical neighborhood, the factors that kept perpetuating malaria are there. Okay? Those factors are there. You look at a neighborhood, the sewage is poor, there are a lot of bush around, water settles everywhere, there are no insecticide-treated net, no drugs are available because whenever any of the people in the village has malaria, they will rather take help. By the time they get drug, they don't know the proper dose to use and how to complete it. And then the communication on how to use insecticide-treated net is not just there. If you're looking at our health system, it's so weakened, it's so dilapidated. We've not been able to strengthen it and be able to pursue a common agenda that will go right to the grassroots in terms of trying to beat back or even control, not to talk of eliminating malaria. So this is where we are. Human resources is deficient. The health budget is always about 5%. We have to look for counterpart funding from everywhere to be able to drive malaria. Our insecticide-treated net, we have not been able to socially communicate it for it to be used and used properly. We've not given attention to our environment because, you see, the weather is hot. These children will have to off their clothes at night to sleep in the thatched, muddy house, and then mosquitoes just get access and bite them and give them malaria. And once they have the malaria, they resort to herbal products, they resort to have treatment.
Which may further complicate the treatment of malaria. But this 300 billion that Nigeria loses every year is not just to malaria. It's other diseases like tuberculosis and other communicable and even non-communicable diseases. Should an emergency be declared in our health sector? We are missing the point if we are not declaring emergency in the health sector. Because the question is this. Recently, a data came out, Nigeria is now the leading poorest country in the world, overtaking India in terms of sheer number of people with malnutrition. The question is that
is malnutrition furthering malaria or malaria furthering malnutrition? We need to ask those critical questions. Because when someone is malnourished, the immune system is compromised, okay? The person will succumb easily to infectious diseases, including malaria. And in fact, ability to access care becomes a challenge because this 300 billion is coming from the treatment of malaria. It's coming from the man-hour loss. It's coming from the death resulting from malaria. It's coming from all the preventions that we need to do that will mobilize drugs and human resources to deal with malaria. So now, for us, really, if you want to turn around the health, the poverty level of your country, you need to invest seriously in two things: health, education. So those are the two things that can really, you know, empower and energize people to contribute more to your GDP. So, I mean, it goes without saying that if we really want to turn around, you know, the economy of this country, we need to take a second, if our first look at health system, and then say, listen, let's declare a state of emergency. Let's look at priority diseases. Because let's face it, Swaziland there, you know, it's a small country. They've done a lot in terms of dealing with malaria. They'll be able to drive the thing down. Most likely the first country in sub-Saharan Africa that will eliminate malaria. And we're saying that in that place, the possibility of mosquito transmitting malaria to you is zero. It's almost zero. Eliminate. A simple instrument in their hand, a code 977 that you dial when anybody is test positive for malaria. They move people into that environment. Within 1 kilometer radius, they screen people. They go back and do indoor residual spraying. They go to the environment and try to tidy and clean it up and move drugs to that place. So that within that 1 kilometer, of course, you'll be able to get, you won't be able to get malaria. And look at it in Nigeria, for instance. Southwest is having the greatest burden of malaria, 59%. So it's not just about, you know, parroting Southwest. The greatest burden of malaria is in Southwest. The least is in Southeast, you know, less than 29%, 59%. And then, is it difficult?
What's responsible for that?
Well, again, first and foremost,
more of environmental
factors? Environment, okay. We need to improve the sanitation, okay. We need to be able to take more proactive measures. Yes, you will say that quite a lot of people stay in the Southwest, but it's not worse than the people stay. It's not more than people stay in some part of the North, you know. But again, we're having that challenge. Now, it's important, for instance, that a local government in a defined area should be able to take clear-cut measures. What are these measures? Simple measures. Treat malaria appropriately and promptly by involving every part and parcel of your community. Do distribution of insecticide-treated nets to households. Ensure that, you know, follow it up by campaign to ensure that people sleep under this net. You know, 3, intermittent preventive treatment for pregnant women. That one is a simple procedure.
But if you have open gutters, polluted areas and all of that, refuse rising up to the skies and what have you all around the environment, all of these measures you're talking about, maybe just dead on arrival.
Yes.
Isn't that where we should start the fight against malaria from? Making sure that the environment is as clean as possible.
I wonder if it's possible to achieve that with the kind of
the
terrain we have.
You need to look at where you are. You know, our terrain is not worse than some part of the world that had. Can you believe North Korea of all places, Iran of all places, Maldives? These people would have been able to eliminate malaria, you know, from their country. Sri Lanka, that has a similar terrain like us. Yes. But I think the will for us is to be able to take individualized action at our level. But government must be able to step it up by deploying that, you know, clean our environment, you know, impose strict hygiene rules, let the gutter flow, then distribute insecticide-treated nets, to make sure that treatment of malaria is cheap. Because if you look at it, the cost of treating malaria itself runs into billions for individual. By the time you multiply 1,000 naira by 200 million people, that's a lot of money. So for us, government must be able to look and straight and be able to say one disease we'll be able to deal with. And it's not, yes, the national thing is good, but we have to act locally if we're going to ensure that.
All right, amongst the about 34 countries that have eliminated malaria across the world, about 6 of them in Africa with the record: Botswana, Cape Verde, South Africa, Swaziland, Sao Tome and Principe, and Namibia. Now, it is one thing to eradicate this. From the report and record we got, sometimes neighboring countries whom have not been able to eradicate malaria, even when you have, you still find malaria coming in, or some mosquitoes coming in from the neighboring countries. So if that's the case of Nigeria, for instance, and we're able to eradicate malaria within our domains, how about our neighbors?
But then again, that would depend on what is the malaria burden in countries like Togo, in Cotonou, in Ghana,
Benin Republic,
for example.
Cameroon, and
how
Niger.
Bad is it in those places that would even be a factor for us?
The certainly is obvious Nigeria has more.
We shouldn't really get so worried about, what
the neighbors are doing.
The neighbors, because again, let's get it. There are two key things. This parasite, there's a mosquito, the vector, that picks the parasite from somebody's blood and take the parasite to another person's blood. Okay? So the core thing is that when we're looking at eradication, for instance, we're looking at the level of the parasite. What do we do to the parasite, which is the malaria plasmodium, the plasmodium parasite, and what we are doing to the vector, which is the mosquito.
The Anopheles
mosquito. And then what we are doing to our environment. So because, sometimes, even in North America, which has the lowest malaria burden in the world, there's still malaria. You see transport malaria, you see transmission malaria, but what happens is that immediately it is seen.
Okay, the response.
The response, they move the person quickly and check around any fever around that place and be sure that the vector is not there.
How do you do that in a situation where self-help, self-medication is actually the major challenge that we seem to have in this part of the world? Anybody has a headache, fever, it'd be like saying malaria.
Yeah, it goes to chemist.
They go to the chemist.
And normally it shouldn't be. You only allow that for, under 5, when they have fever, and you can say, okay, you can treat empirically. But for every other person, you must do a random diagnostic test, an RDT, to confirm that actually your fever, your headache is not from the stress of traffic or the rain that fell in your neighborhood yesterday. So, you must do it. But again, self-medication, because the other thing is this, we have very few molecules to deal with malaria, and that's artesunate combination therapy. That's what we're using now. But interestingly, if we misuse it, we're going to have resistance. Nigeria and few countries, 4 countries, is having 50% of the world burden of malaria. It's shameful. So the only molecule we have, if we don't use it properly, and we have resistance, these are disease burden of the developing world. You won't see it's not a big deal for them in Europe and America. It is we that have the burden, and we must be able to respond to it appropriately. Because at the end of the day, if you are not having counterpart funding for your program, you're gone. All your budget will be taken over by malaria and its complications. All right,
the issue of data is quite important when it comes to the ability to eradicate and eliminate malaria. How more compounded are the issues of ability to eradicate malaria from Nigeria, where we complain there are no proper data to the population, there are no proper data to the terrain, the housing, and all of that?
Again, data is quite, not just data. Data will help you to push surveillance and monitoring. Okay, because the key thing is that you may be able to, monitor and, and deliver surveillance, proper surveillance methods to back down the thing. But one of the things that is actually affecting the data is actually the willingness to even collect the data in itself. Because data is supposed to be driven from the locality, from the local government, where you have the numbers of people that came and are positive for malaria. And then, you cascade the data, up for proper decision making. But in time, there are gaps in health system, even when you're saying that there's joblessness in the country. You can train people to pick data. It's a very useful intervention. People that can pick data, at least we have local government, we have words. And this makes it easy for us to be able to capture data and feed into the system. But the way forward actually is to be able to make the data as interactive as possible, that we have a platform, somebody can easily go, whether it trace ISSN code or SMS code, and then be able to upload some basic data that will help decision taking. But if we are still looking at these big books, the way you have to write every time, rain fall on books and they get...
and according to the World Health Organization in April of this year actually said that Nigeria is far from eliminating malaria because there's no significant progress in the fight. That is, the political will seems to be lacking. So should we now begin to look at not just leaving the whole burden on government? What is the role that the private sector can actually play? Maybe some kind of private sector partnership with governments as part of their CSR, for example.
Again, they must be able to. For us, let's be fair. Let's be frank. We have too many things to resolve that we cannot start. We may not have the sufficient fund, you know, to deal with malaria. And where are we looking up to? We are looking at partners. We are looking at corporate individuals that have businesses in Nigeria that are making some profits from Nigeria to say that, listen, if I contribute to health system, I'm going to get reward by people patronizing my product more, and my workforce will be stronger. So we've seen what the likes of Bill and Melinda Gates Foundation is doing, you know, the massive money, you know, eradicating polio from the world, you know, malaria fight, TB fight, nutrition, agriculture. So you see a lot of things, you know, because at the end of the day, human value will be increased. They'll buy more of their product. They will also make more money. This company should see investment or, you know, or response to health system as part of puzzle of improving their business environment and getting more money to themselves. I think, honestly, at this point, nobody can leave the fight, the spending for malaria in the hand of government alone. Yeah. We are not going to get there. So within your community, within where these people are, apart from that, individual must be able to sufficiently educated to know that these are the limits, these are the things I'm supposed to do to limit malaria bite. We start from there, but we should be able to see a kind of response that will be so key, you know, in changing the narrative of this continuous loss.
And then, of course, there's a danger of, you know, the rural Nigeria being left behind in the war against malaria.
Absolutely, because again, that is where most of those
exactly. And Nigerians are still very concerned when it comes to budgetary allocations to all of this. It's just merely about 5%. If you check allocations since the past 10 years, it's always been very meager. All right,
the stuff to do to change health system without proper funding. That's a fact.
Yeah. Dr. Tuyi Mebanwodu, thank you so much for joining us.
My pleasure, always.
This morning. Hope the next time we talk about malaria, we'll be talking about the gains that we have made in the fight. Thank you so much. All right.